What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. And today's video, we're gonna cover some of the X-ray slash when you're interacting with doctors or with other medical personnel. For our field, the verbiage or the medical terms, I guess you could say, which I'm just giving you what occurs in the emergency room. Obviously, if you work in the main radiology, or if you work in the OR, or in the ortho, or other departments of X-ray, the verbiage may be different, and depending if you have like the old school doctors versus the more like younger-ish doctors, completely different verbiage. I've seen some of our emergency room doctors that are like super old, and I hear them talk, or they talk to me stuff, and then I Google what it is, and it's like the same thing that the younger doctor use, but it's just like a more older medical term type of stuff, whatever. So the verbiage can change depending on them. But I mean, for the most part, our job, I mean, you don't really use too much, like nothing crazy words, like I would say, because majority of it, the words they do use that are, I guess, medical term, you learn them in X-ray school, and they're pretty kind of simple. Like, let me give you an example. Let's say they're doing maybe a central line, maybe patient got intubated, or they'll like look at the X-ray, they're like, oh, can you invert the image? And you're like, okay. Depending on your portable, you may click it a few times. Inverting the image is essentially when you flip it inside out, essentially what you're doing. So it looks kind of more black and white, and you can see the lungs better. And then there's another post-processing technique on your portable where it kind of enhances it. It makes it kind of more grainy, more like, so you can see the lines better, like the lines they put down their throat, or they do. And it kind of looks at like more, how would I say, I guess not grainy, but like more realistic type of thing. I can't really explain, because it depending on the but it's a little button you press, and you can kind of change it like that. Or I mean, majority of the times it's you'll X-ray something, and they're like, can you zoom it in? And you're like, okay, you just a little tap. Let's see, for like anyone who breaks their bones, the doctor may look at something and then tell us, oh, it's broken, depending on which way. It's like, oh, that's a spiral fracture, or that's a so-and-so fracture. They'll name some fracture, which it doesn't matter how it's fractured, and that doesn't really mean anything to us. You'll still kind of do the same thing regardless of what he says. So even if you forget what kind of fracture and how it's whatever, it really doesn't matter, because majority of the times they're either gonna leave them like that, pop it back in place, or just cast it, and then you have to do like post, and then it'll be like AP or lateral majority of the time. Other like, oh, can I get a wide view for the shoulder for the dislocation? Like I think our world, compared to like my lady who's a nurse and their medical term, I feel like the nurses use higher way, because they'll be talking and I'll just be sitting there listening sometimes, waiting to do my exam, and they'll be saying medical words, and I'm like, I don't know what you said, but I'm assuming that's a drug and that's a dosage. This is what I would assume. And they used to giving like the patient some rock, some this, like all these other big words, and I'm just like, we don't really use super big words. Like maybe in the main radiology, I could see you with the RP, you with the rad, using bigger words, but like we really don't use nothing crazy in ours. Like, I mean, amongst our peers, the verbiage is mainly, why are we doing this? SOB, CP, like chest pain, short of breath. And then you're like, okay. And then there's like certain, like you look at the orders and the doctors will put like pneumo. And then there's different verbiage for pneumo, different abbreviations for pneumo. But like majority of the times, we just end up like, you can look at the reasoning why, and most of the time you just copy that reason and then just slap it on the reason why you're doing it for the rat. That's like, you, even if you don't, so for some reason you forget what it is that it says, or the abbreviation, like majority of the times you just copy it, slap it on the chart for the rat, and then that's really it. Like even if you forget, it's still, I mean, a quick Google search, something, but like majority of the times, it's the same thing. Like, it's something that amazes me about our field, because like the nurses and other doctors, or even residents, the amount of like notes and stuff and medical verbiage they put on their notes, it's like you'll look at it and you can like go through it and like it's so extensive and all these big words, and then you got our department just copy and paste whatever the nurse, whatever the doctor put, and majority of times it's like a little tiny little thing. Or if you maybe want to be a little bit more detailed, if the patient tells you some history, you may type it in. But like it's nothing too crazy, to the point where like and almost majority of the times where I work at, it's a trauma 3 overnight. We just do a lot of chest X-ray, so majority of the times I just have a bunch of like different versions of chest diagnosis. It's like hemothorax, pneumothorax, post what's it called, thoracentesis. Like there's like different verbiages and stuff. But even with all these verbiages, some of them, yeah, it's more important to know what they are because you're looking for maybe like a pneumothorax. But other times, if you take the chest X-ray and everything is in there as far as the chest, that's what really counts. Now, sometimes for like certain stuff, like for NG tubes or KUBs, for that you're looking for specific lines, or like a central line, or for like a PICC line, yeah, maybe you have to like, you may have the anatomy of your chest, but then you're looking for the other stuff. But those kind of, with time, you can kind of understand where it is, and maybe that specific verbiage would be important, because sometimes at the beginning of my career, I think one time they were looking for a PICC line. I got all the chest, but like sometimes the PICC line runs from the shoulder and you can't really see it all the way. So like one time I had to like just do a shoulder X-ray, and that's where the PICC line was. So just with time, you'll kind of understand all the verbiages and stuff. And maybe I'm just blessed that at my hospital, at my situation, we don't really use crazy amount of verbiage. And even if they say something crazy, majority of the times I go back and I look at my order and I'm like, oh, okay, they just want this, they just want that, and it's nothing too crazy. Because like the doctors will use big medical words and stuff to the nurses or to this, to explaining to the patients and all this, and then they look at me and they're like, can I get a chest, or can I get a PA this, or can I get a forearm, or something like very, very straightforward, simple, what they want. Or they'll just tell you what body part, and that's it. Or maybe a view, or they'll say like cross table, or they'll say this and that, a decubitus, lateral, and it's like simple verbiage that doesn't require too much, like, or who knows, maybe to someone who's barely starting out in the field, some of this verbiage may be like you really have to think about it. I mean, to me, I've just been doing it so long, and I've been doing so much overtime at work that I'm kind of just used to it. So, but that is kind of some of the verbiage I could think of that is used amongst our department. So yeah, it's been your boy Miguel. We'll see you in the next one.